We're ending our Women's Health series with a topic that affects 1 in 5 women. Anxiety and depression are just a few of the many ways that some mothers suffer with perinatal mental health disorders. It ranges anywhere from conception to months after giving birth. And Dr. Katayun Kayani is a perinatal psychologist and board chair of the organization Postpartum Support International. She's joining us this morning for this conversation. Thank you so much for being with us.
Thank you so much for having me.
Yes, so I basically describe what perinatal is, that time period. I think a lot of people who aren't parents aren't even familiar with that part, and we're trying to raise awareness.
Absolutely. Thank you for asking that question. It is confusing for some folks. When we're talking about perinatal mental health, we're talking about a time period that lasts from about conception through pregnancy, birth, and about 12 months postpartum.
Wow.
So there are different definitions for different specialties, but when we're talking about perinatal mental health, that's the time frame we're talking about.
Okay, and this is something that affects a lot of people. We're talking about 800,000 parents a year. Tell us, what are some of the risk factors that can cause this during or after pregnancy?
Right. Well, there are quite a few. And what I want to say, too, about that 800,000 people is only about 25% of people actually seek out and get treatment for this.
Wow, that's not a lot at all.
Right. And part of it is because people don't know what their risk factors are and sometimes don't even know what they're experiencing.
Right.
So some of those risk factors could be any history of mental health conditions for yourself, any within your family. If you're having any real difficulties during your period, like if you have really big mood swings or challenges emotionally during that time, that could be a risk factor.
Okay.
And there are also so many other things that happen in our life, like stressors, things that are just happening to us that can impact how we move through pregnancy, birth, and postpartum.
Okay, and you hear women say, oh, I had a baby, I'm super emotional, or even their partner is stressed trying to support them. How do you know what of that stress is normal and what is alarming?
Well, some of the things we look at is duration and intensity of symptoms. So in the very early postpartum, we call it the baby blues. So if people are experiencing mood changes within the first 2 weeks after giving birth, that can be like some tearfulness and some crying and some changes. You know, you're adjusting to time as a new parent. But if you're having symptoms that are lasting longer than that, or they're more intense than just kind of your mood has shifted a little bit, then we might be looking at something like a perinatal mental health condition.
Okay, and perinatal mental health condition, I think, makes sense for most of us in the context of a woman delivering a baby. I think surprising for me is that men suffer from this as well.
Yeah,
in
yes,
what way?
Absolutely. So about 1 in 10 dads can also experience postpartum depression and anxiety, because they also have life changes that they're experiencing. There is some research out there that shows that they have some hormonal dips as well.
Wow.
And so, yeah, we can't discount dads and partners who might be experiencing some symptoms as well.
Okay, so postpartum, your group, tell us more about what they do to support people who are going through this.
Postpartum Support International is an organization that was founded in 1987. And our mission is to bring together families and professionals and communities in order to help provide support and free resources to people who are experiencing perinatal mental health conditions like postpartum depression, anxiety, OCD, bipolar disorder, and postpartum psychosis.
And so the support is there, but as you mentioned early on, only about a quarter of people impacted by this are seeking any kind of help. How do you raise that awareness so people start getting this help?
Well, part of that is what you're doing, thank you, is talking about it. And this is so important to let people who are just sitting at home, you know, maybe just learning about this for the first time, or maybe hearing that they are having something like this, so that they have information and education. So that's like breaking the stigma is a huge part of it.
We know you recently interviewed Alanis Morissette, the singer and songwriter, about her postpartum journey. So let's listen to a little bit of that.
These darker parts and the swampy, covered in tar parts, and that's what postpartum was for me, all 3 times progressively worse. You know, this entered into a whole new self-perception too of maybe I am a human being and I'm vulnerable in a way that kind of goes against what my egoic identity was, right? It's this, you know, I've been proud to put out into the world this archetype of me that is a combination of vulnerability and slightly mercurial, but also wildly serviceful and empowered and expressionful. But all of those things kind of die when postpartum took hold. And I'll probably weep my way through this chat with you both, but it's like your whole self disappears. So,
right.
So yeah, do people turn away? Do people not want to hear about that? Of course they don't.
Right.
Until they do, until they're in it themselves. And there's some, there's that. It's exactly what you said when we just first started talking today. The feeling of being alone in it is the worst part.
What are some of the signs of someone who's dealing with this?
It can be varied because there are different conditions that people are dealing with. So if it's kind of more on the depression side, they could be having long periods of sadness actually and tearfulness. They could feel unmotivated or having difficulty sometimes connecting with their baby, but that's not always the case. If people are feeling anxious, they might be worried all the time, having difficulty sleeping. And I know I went through a perinatal mental health condition myself, which is how I started specializing in. I didn't know what was happening, just like a lot of people out there don't know what is happening. I thought I was just like, maybe this is motherhood.
And it felt,
this is how it's supposed to be.
This is just what life is now.
Yeah, but when it got really difficult, I felt like, oh gosh, I'm not being a good mom, and it can get really
dark.
It can get really dark.
Yeah. And a lot of the conversations we've had around Women's Health Month has been about us advocating for ourselves, but it's almost upsetting that our healthcare providers aren't giving us the heads up about this. Is this not widespread that when a mother comes in to deliver a baby that a doctor tells her this is a risk?
Well, sometimes it's mentioned, more and more it's being mentioned, but unfortunately a lot of medical providers aren't getting much training in perinatal mental health disorders. So they might give a screen, a depression screen, and check for symptoms, but like you said, the way our system is set up is that we are not monitoring moms and birthing folks very far past the time that they've given birth or even during pregnancy.
Oh, that's so disappointing. I think for many people watching this, hopefully this is helping someone. What should their first step be? Do you go back to the doctor who didn't warn you about this?
You can go to postpartum.net, Postpartum Support International. You have a lot of resources on there that help people even understand what is this that I'm dealing with. There are free support groups, and in our resources, connecting with other people can often help you understand how to talk to your providers. But certainly there are providers out there who are very well trained in this and can help. So if you go into somebody that you feel comfortable with, who you feel like can really listen to you and not discount your feelings or tell you, oh yeah, you're a new mom, you're tired, everybody's tired, you'll be fine. But just to really listen when people are telling you that they're not well, and reach out to somebody who will listen.
You're doing such amazing work. Thank you for being here to share and talk about this, because to have healthy communities and healthy babies, we have to have healthy parents.
That's right.
All right, thank you so much for being with us. You can find all the information on Postpartum Support International on our website, kcalnews.com/seen on TV.